Ambazone tablets are active against Streptococcus haemoliticus, Streptococcus viridans, and Pneumococcus. Antiseptic agent for local use in dental practice and dentistry. It has a bacteriostatic effect. Indications: prevention of infectious and inflammatory diseases after tooth extraction, prevention and treatment of acute infectious and inflammatory diseases of the oral cavity and larynx, tonsillitis, stomatitis, gingivitis. How to use: tablets shall be sucked until completely dissolved, 15 to 30 minutes after a meal. After taking the tablets for 3 hours, you should refrain from drinking and eating. Adults 4 to 5 tablets per day. Children from 3 to 7 years, 3 tablets per day. The course of treatment is 3 to 4 days. Contraindications: hypersensitivity to Ambazone. After taking Ambazone, it is recommended to refrain from eating and drinking for 3 hours, assigned to children older than 3 years. Side effects: possible allergic reactions.